So the next generation of young doctors in aesthetic medicine, it'll be mental wellness, longevity, and aesthetic medicine. They'll all blend together into the one thing. Now, the potential benefits of secretomes over exosomes, they're safer and they have less immune problems. I don't think that exosomes are not safe, but they're just taken into account their stability per se. So this was made up from my Cambridge lecture. So obviously, if you're dealing with something that needs widespread repair, in other words, Alzheimer's, Parkinson's, brain inflammation that's sort of kicking off, then secretomes are better because they're sort of doing everything. I'm not keeping an eye on my time. How am I doing? I'm okay? Keep going? Right. In terms of the difference between secretomes and exosomes, exosomes excel in precision. They're better at doing one thing, but secretomes are better across the thing. Now, we use them for hair. I used to have 20 hair transplant clinics, and we switched over after the Irish recession. And I'll just show you, the ones we use come from bovine colostrum. Somebody was asking me about these last night. This isn't necessarily promoting this, but these are the sort of results that you get from secretomes and hair. This is with skin. Now, one interesting thing I want to show you, the way things are changing, is you can get secretomes from hair follicles. So you don't have to do a biopsy. You can take a person in and just pluck some hair follicles. Doesn't leave any scarring. Anybody can do it. And you can send this off then. And secretomes, actually, your own personal ones, can be made from these hair follicles. So this is a whole new era. Canadian company has sort of started with this, and you can preserve your secretomes for years. Now, as yet, what they're doing is they're using these topically. I've used, I suppose, in terms of vascular occlusions and burn tissue, certainly with calcium stem cells, which also have exosomes, for many years in red light. And it will make this product. What I didn't realize at the time was stem cells, when we use them, don't work very well. No matter what they say, we thought one generation ago that the work done in Tel Aviv with spinal cord injuries, that stem cells would cure that. With hearts, they didn't. The potential is there, and what is wrong is they're like kids in a bad estate or in a bad housing complex, just breaking into houses, spraying graffiti. Stem cells are doing that at the minute, but they have the potential to be turned. And at the time I used red light, and I didn't realize that it was a vector for making stem cells work properly. And now we're going to use exosomes, because exosomes can tell cells what to do. So if we use them with stem cells, and we have a whole thing starting in Oxford soon at this here.